I took a lot of pride in this mindset. And this actually, my very first mentor gave me this quote, and it's been a very important part of my mind ever since. He said, you can practice for 30 years and you can have the same year 30 times, or you can have 30 years of practice. Always be kind of learning, evolving. And he would follow that up with change is inevitable, growth is optional.
Hey, Dr. Chris Goebbels here with the Health Heroes podcast, and today we have a special guest, Dr. Andrew Hicks. And Andrew, we actually know each other because Andrew is also an advanced certified in chiropractic biophysics. So it's a special treat, and I always love being able to sit down and visit with other corrective care docs. So thanks for being on the show, Andy.
Awesome, thank you.
You're for Andy or Andrew?
Mostly Andrew.
Andrew, Dr. Andrew.
It's all the same at that point.
So Andrew, I want to start by getting some of your background. A lot of people get into healthcare professions for different reasons. Is there anything that's specific that led you into becoming a chiropractor?
Yes, actually, I don't have that, injury in high school and a chiropractor fixed me story. I was headed to medical school and decided that just being a pharmaceutical rep wasn't made for me. Along the way, I worked in pathology. I did that for the better part of 5 years, where I did things like autopsies, stuff like that.
What were you doing?
It was in the hospitals. We would get the surgical stuff. I'd dissect it. I would describe it, prep it for the pathologist, who would then, under the microscope, diagnose whatever the answer of that person's.
So you were prepping for autopsies.
I was also doing the autopsies.
You were doing it.
Yeah.
So what's that called?
Pathology assistant. It's a PA specific to pathology.
Wow.
So I wasn't a PA like you would see in a clinic setting. I was a PA, again, specific to pathology.
So what's your most memorable experience doing that?
First autopsy. It's always the most memorable. Autopsies aren't, because this isn't cadaver lab. Cadaver lab is you walk in and the body's there. They've been there sometimes years.
Preserved.
There's almost no odor. But you do an autopsy, sometimes that person's 6 hours.
Fresh meat.
Yes, literally. And so that can be, especially when you get to certain sections of the body, and that's your first introduction to really, probably a hunter is the only person who could relate to what that's like. And then, because there's no preservation, it's not formaldehyde, it's none of that. It's find the cancer, find the tumor, find the whatever.
You go to school to get a degree to do this. That's like the degree.
That particular training started with just having a bachelor's degree, and then they did the training with me. So the first year or so was simple things. I'd get like a skin biopsy, just measure it, describe it, and be done. And then it evolved. I did that again, like for about 4 years, 2020 to 24. And by the end, I was doing the autopsies, prepping the bodies. Then the pathologist would come in to do the investigative work.
That's how Dexter got started.
They didn't let me buy saran wrap, that stuff.
Oh, wow. I had no idea you did that.
Yeah.
And it was during that time frame you were like doing like your preps for medical school? I had
kind of ruled, this was my last foray in medicine, to kind of figure out what I really was going to do.
Mm-hmm.
And in that, the conversations even with the pathologist were like, oh, well, here we have this particular section of the body. They'll just put them on blank medication. We'll get their kidney in 6 months. And it was that kind of comment. And that really tracks with healthcare today, where it's get this medication to mask this. It'll create this problem, which we'll later treat with this medication or surgery or whatever. And it's this cascading effect.
Interesting.
That led me to look at something else. And my mother is a migraine sufferer. She's a migraineur. And so I thought, okay, what?
Migraineur?
Yeah.
Is that a term?
That is.
Is that one you just said actual term?
It's the one, well, it's the one she taught me. I'll put it that way. It's the one she taught me. She is an MD. So I don't know that that's still technical. Maybe it's her word the whole time. But she suffered from migraines like 3 to 4 a week. So she was on Imitrex at a dose that caused rebound headaches because she was taking it at an excessive level, forced her retirement through disability, actually. But that led me to chiropractic because I wanted to help her.
Did she ever get chiropractic care?
Mm-hmm.
Before you?
She did before me because I was in school, and that was where I went to school in Life West. She's in Tucson, Arizona. So I found somebody there, got her care. I didn't really know corrective care at the time. I just thought anything is better than another shot.
And as a medical doctor, was she perceptive to that, or was it?
She was anything at that point. But you hit rock bottom, you'll try anything.
It helped her?
It did. It definitely helped her. And then through a slightly different, she had already started the opioid cascade though. So she was put on an opioid before it was news, but way before it was news. This is probably
20-something years, because you were starting school at this time.
I was probably still in college when she was first put on opioid. And so that was not even, being a chiropractor wasn't even on my radar at that point. So later, the interesting part about this was the chiropractic helped, but she really needed more corrective. And to make a long story short, I would travel from Prescott to Tucson, because that's about a 3.5 hour drive based on Phoenix traffic, could make it a lot worse. But I helped her through the withdrawal of coming off the opioid. So that was actually where I did the most. And that was a lot of extremity adjusting, just stimulating the brain outside of because withdrawal symptoms are like.
So you were going to chiropractic school in Arizona?
No, that was after school. So
gotcha.
Chiropractic school is Life West.
That's right. So you started there right out of school.
Right out of school, I went straight to Prescott. Worked with a guy for a year there, then went on my own.
So how did you first get introduced to chiropractic biophysics? Was it in
Jason Miller?
Jason Miller.
Yeah. And so what happened there is when I was leaving Prescott, which was actually a great experience too, because while I was in Prescott, I worked for another doc. I built a practice, sold it to a doc who had an integrated clinic. So I got to work with MDs, PTs.
Yeah.
That was a really great experience. We did stem cell injections before I knew anything about stem cell injections. And that was a great experience just to see the evolution of the patient care. But when I left, I thought, I want a better form of care. So I just called Jason and it's like, hey, bud, talk me through this. And he introduced me then to Deed, and then the rest is history.
Nice.
Yeah. Bought a clinic that kind of they had implements of CBP. They had old school Pope, with the wooden ones, if you've seen those.
Yeah.
Yep. And
I built those. I remember when I was doing my training, I was out in Boise, and I measured all the deeds, and I went back and had a guy build my own.
They were built. They may have even, but yeah, that's how I started.
I actually still have those built ones in my storage.
They're kind of neat, reminiscent. Yeah, it's like the museum.
I don't know. Mine are nice. I liked them. So yeah.
What I liked about the ones I had is they had the track, kind of like the
T-track. We had it on ours.
Yeah, so your angles could be really specific.
100%.
Yeah, because you could move inches instead of like the UTS where you're stuck with 6 inches or so. But
absolutely,
I really liked them. We had great corrections with those. But bought that clinic and then built it, and obviously then just started going out to Boise for trainings, all that stuff.
So people watching this, they may not or they probably don't have background in chiropractic biophysics, but explain, like, in your own viewpoint, like, what's different about the type of chiropractic care you do compared to a traditional chiropractor someone may go to.
I had a patient who was very skeptical of care because he'd been to chiropractors many, many times. And he would wait in the lobby and he would watch the chiropractor treat. And whether it was a 7-year-old or a 70-year-old, they got the exact same treatment. And so he asked me about that. And I said, it's not what we do. Chiropractic biophysics is tailored to the unique findings of that person, also to correct, uniquely to their shapes. So our treatments, mirror image adjustments, all that is very, very unique. And so the challenge was, come sit in my lobby and just watch. If you see two things the same, let me know. And that's when he sat there. He did. And afterwards I talked to him and he's like, yeah, I didn't see two things that were the same. And he thought that was truly the difference between what we do. And then of course, I treated him and his results were fantastic. But it's that microscopic approach almost to tailor uniquely to that person's goals and and findings.
Yep. And ultimately, you're trying to reshape the spine
Yep.
back towards its normal form, but you're also looking for and doing a thorough analysis to realize what is normal for that person.
That's a conversation we have a lot. We measure like their PTPIA and their pelvic incidence, and we say
You're basically measuring the size of their pelvis, their anatomy, to determine how much curve is within a normal range for that person based on their anatomy. And stuff like that.
Yeah, it's based on that person's unique findings as opposed to just putting a template up and saying everybody should be 40 degrees or something.
100%. So curious, do you have a favorite patient story or one that sticks out to you?
My favorite one is it's a fun one. This is a guy who lives in Kansas, actually. And he found out, long story, how he found me. But he found me and he came out, and he's one of those guys. He's a cool story, though, because he's a very in-depth carpenter. He's the guy who's hired by the 10,000 square foot home person to reach over, you grab the bookshelf off the bookshelf and the thing opens up. Yeah, he builds those things.
He built one of those in here?
That would be cool. Come do my house, or come do my clinic. But that's basically, so he came out to do a project out here and he saw me. He would see me 2 or 3 times a day for about the month that he was here. 6 lumbar compression fracture and 5, 6, 7, I think even up to 8 millimeters of retrolisthesis and instabilities in his lumbar spine. So we did very aggressive traction with him. He really pushed it. That guy, I'd give him the rope to tighten himself in tighter based on with each session. And to make a long story short, post looked fantastic. Went back to Kansas, came back to visit randomly about a year later. We took a follow-up, still the same findings. So everything.
Still the same, he held the correction.
He held the correction. Yeah, still the same. The correction held. And then 3 years later, again came back after that. So I have a 4-year follow-up on this guy, and one at the fracture site, at the compression fracture. That guy has started to wedge back, but still it's 70% from where it was when he first started. Yeah. All the other findings, all the other correction is still held. And this is a guy who's still up and down ladders. He likes to brag to his son that he outworks him, and his son was a high-level D1 football player. And he outworks him every day. Per him, of course.
Yeah, interesting. So how about when you're not in the clinic? What do you do? Like, what's your life like outside of here? What kind of things do you do for fun? Or
we got 2 kids. They're 14 and 12, so a lot of it revolves around their basketball and volleyball schedules. So that's a chunk of it. You know, sometimes I jokingly say I'm a glorified pack mule as I take them from place to place. But leisurely, I love to golf. That's the sport I wish.
I didn't know that.
That's the sport I wish I got
to play. Annual when you go out there?
I usually golf at the annual. I'm headed this year, but I don't.
You golf.
I don't get the chance to play this year for, my associates on maternity leave, and so I'm sitting here doing all the work. So I have to work all the way up until I can basically walk into the annual this year. Missed the round of golf this year, but yeah, golf's my.
So what's your handicap?
Climbing faster than I'd like to. Was around a 12 when I was more consistent. Now, of course, if you're not consistent, all the minutia goes away. I 3-putt more than I want to. And I'm older than I was when I was a 12. So I probably play closer to I go out and shoot anywhere from an 80 to a 95. It fluctuates that much.
I'm always happy to break. If I can break 100, I'm good. That's my goal.
When I get down to the 80s, I'm always happy because that's where I was really happy when I played consistently. But, you could play around a golf with me and you'd see both sides of that game.
Excellent.
Yeah.
Excellent. If there was something that you wish people knew about just chiropractic or their health in general that maybe they don't, is there anything specific you wish or they understood about just what chiropractic is? Because there's a lot of misconceptions and people maybe have done one thing, but that's not how it's done everywhere.
That's a big one. Patients who've had experiences as chiropractors, they have a tendency. Somebody goes to a dentist, they have a poor experience. They don't throw away the dental profession. They go to a new dentist. And that's really the problem I see with the chiropractic. I don't want to say the profession, but with patients who've had a bad experience, is they now assume, okay, that doesn't work. It's like, no, that technique didn't work.
Well, even the same thing is people have different specialties in what they do. I was my associate doc in my clinic before Collins was on leave. He's on vacation, and I was covering. And we had a lady come in for pregnancy, and she's like 31 weeks pregnant. And I was like, you know, you might want to go to like a pediatric neonatal chiropractor. This chiropractor is like, this is like what they do. Like this is, I mean, we can adjust you, but it's not like our thing.
Right.
And she's 31 weeks, and I'm like, yeah, you should be adjusted on a weekly basis. And no, I can't adjust you like I did when you were not pregnant. But I was like, and she was kind of asking about the process, and I'm like, I think you might want to go see someone that actually just takes care of women that are pregnant and kids and infants. I go, that's like, if you realize that's all they do.
100%. And you mentioned it's specialized. It's kind of like the medical profession. You don't go to the orthopedist when you have a heart problem. And you don't go to the cardiologist when you have a knee problem. Chiropractors have a similar specialty, just like you mentioned that.
Yeah. I mean, and then at Scoliosis, people come to us all the time that sometimes they're pretty advanced, and a lot of times there's still things we can do to help them. But a lot of times I think, God, I wish I would have got you in earlier, because people are just trained to wait till there's nothing else they could do. I mean, do you see that in here too? People come in, oh, you can do a lot for them. You think, man, if you would have came in here, I could have got you, 15, 20 years ago when this was first starting, like how maybe would it be different now?
Yeah, being more proactive, understanding that chiropractors like us exist, where that scoliotic curve or that retro or that translation, any one of those postural deformities that can show, they're not a problem today, but they're going to be that problem that they're going to show up at our door 15 years from now, where we go.
Or it may not seem like a problem, it may not seem like an emergency yet. Yeah.
Yeah, that would be awesome to have a shift in mindset that way. And I hope we're heading in that direction with some disenfranchisement with the medical profession being just here's another script. Mm-hmm. So hopefully we get people starting to. I would love it when the patient shows up and they're like, fix it now.
I think
that doesn't happen enough.
Let me go find my magic wand real quick.
Yeah.
But I think even like younger people, like younger medical providers, are really weary of opioids and pain medications, and a lot of them don't know what to do with musculoskeletal things, and they're looking for things natural and stuff like that. So I think it's a lot different than maybe it was 20, 30 years ago.
Oh, I think that's for sure different. I have medical doctors that I work with, and if I can get into more of those doors, because I think we are a solution that they just don't know exists. Mm-hmm. And that's make a huge change.
And you guys also do a fair bit of personal injury work, correct?
We do.
So taking care of people that are involved in a car crash or injured or something like that. I don't think a lot of people realize how you have to really think about who you go to as a provider if you're injured in a car crash and it is a medical legal situation. Can you talk a little bit about that? And what kind of trainings have you done? Because I've been to seminars with you. Mm-hmm. I know you've done a lot of training in the med legal world and understanding traumatic injuries, but can you explain a little bit about that and like what patients may not understand or realize about doctors with different training and how there's a specific skill set and knowledge when it comes to, one, properly treating and documenting someone when they're in an injury, when they're in a crash, when they have an injury, and how that could potentially outcome them getting their bills paid, a settlement to cover their pain and suffering. Like, talk about that.
So that was my first experience with that, was even way back with Croft.
You were the Croft seminars?
I didn't make it to San Diego for the certification stuff.
You did the modules?
Yes.
Yeah.
Yeah.
I mean, that's all. The one at the end, the big certification, you're just going through research. The modules when you're just going through all the meat. Getting us up there.
And it's one of those things that, it's that moment. It's kind of like scoliosis. What they teach you in school and what you need to do to treat scoliosis, almost what's taught in school it's nowhere near what it should be.
I think about what we learned in scoliosis, and I remember we had a class, I'm trying to think what it was called. It was something musculoskeletal, something, and they pretty much explained a few different types, like idiopathic and congenital.
Yeah.
Maybe they basically said this is what they are. That was it.
Yeah.
There's no, you don't treat them or whatever. It's like, this is a congenital scoliosis. This is an idiopathic. That was kind of, as far as I recall.
What do they always say too? Push down on the high side of the rainbow. It's like,
probably.
Yeah. And that's just the most, anyways, it was that moment that said, You don't know what you don't know.
Mm-hmm.
That was basically it. They do not prepare you in chiropractic school to treat professional or personal injury cases because the level of documentation, it's not a subluxation. You have to prove something. You have to show.
Demonstrative evidence. You have to demonstrate in your records what's going on. If that's a simple diagnosis, you have to explain the injury, the pathology, and probably most importantly, like what it actually means to the patient. That's all the insurance companies and attorneys have to look at is what you put in your records.
Right. And so if you just say an old kind of a traditional chiropractic subluxation, it's not
subluxation, sprain, strain, whiplash associated disorder.
You have to have that proof. You have to show it demonstratively.
Yeah.
Measure it, take the images, appropriate images, document it, and then let the patient know too, hey, you have this.
So explain how you measure some injuries that someone may get as a result of a car crash.
We take digital films here and we digitize the x-rays and we measure them down to the millimeters, and it's AMA guides.
So what you mean is there's a certain amount of motion any joint should have. And
correct.
Through your software, you take them in a neutral, but you'll take x-rays at different ranges of motion, and you'll measure if there's excessive or abnormal motion in a segment. But people realize that if you hurt your knee, let's say you tore your ACL or a ligament in your knee is going to be moving more than it's supposed to. It's unstable.
Yes.
And people understand that it's be painful. That's a problem. If you don't fix it, that's going to cause more problems. But the same thing happens in your spine, and there's tools like you guys use that you can actually measure for those injuries. And you can actually say, not only are they in pain, but this is why they're in pain. This is the injury, and here's how I know.
The ACL demonstrations are very, very accurate because that's an unstable segment, and we're measuring the translations and the rotations, just like you mentioned. Objectively, too, what's nice is I send that x-ray to a radiologist in Florida. They're going to say, yes.
Yeah. And they can come back and say, yeah, this is abnormal. So you have demonstrable evidence of the pathology that we know can be caused from the trauma.
Correct. Yeah, and there's a bunch of those studies dating all the way back to White and Punjabi, even the mechanism of injury, the whiplash-associated disorders that occur from the acceleration-deceleration. Yeah. And that's the language I try to change my patients to. It's not whiplash, it's acceleration-deceleration. But
yeah, say someone has whiplash is like saying, I fell down the stairs.
Right.
It's a way injuries can happen.
Right. You can fall off a ladder, hurt an ankle or a head. Falling off the ladder is saying whiplash.
Mm-hmm. So you guys do the chiropractic biophysics, the corrective chiropractic care, where you're reshaping and remolding the spine back to its normal shape. Mm-hmm. What are some of the other services that you guys offer here, and for what kind of things are those a candidate for?
We do dry needling. We do decompression, disc. Decompression is great for disc injuries. Mm-hmm. We have
sleep. Pulls and elongates your spine. You can target different segments. It helps the spine heal and recover and rehydrate.
Yep. And
I don't know how you practice that decompression.
I don't know either. It's we use it in all kinds of treatments too. But the person who says they have like sciatica, tingling, numbness in the arms, decompression's great. Dry needling helps a tremendous amount with muscle tension, the cervicogenic headaches, those things. We offer massage here in the clinic. Shockwave as well, tennis elbow, things like your plantar fasciitis. We use shockwave a lot for that.
So explain what shockwave is and how it helps heal those kind of injuries.
So shockwave sends a pulsed acoustic sound wave into the tissue. I had this analogy given to me not too long ago, and I think it makes sense where you take like a snow globe and you kind of shake the snow globe and it shakes things up inside it. The snow globe activates, things start happening. That's kind of like what happens with shockwave as it goes into the cells. It kind of wakes them up, if you will. And then that starts everything from the healing process through all the way into regeneration, because it actually activates some elements of the regenerative properties.
Yeah.
It's kind of like mini PRP.
Yep. And recruit your own stem cells into the area and restarts the healing process.
Yeah.
Process as well.
It's like that hard reset on a phone when it's glitching up on you.
Excellent.
Yeah.
I'm curious, as a chiropractor, and we see some things happening differently in the political landscape with new policies, potentially not having pharmaceutical ads on commercials. There's a lot going on in our healthcare system and nutrition guidelines, those things. Like as a chiropractor, I don't know how you feel, but I'm like, man, this is what chiropractors have been talking about forever. And it seems radical to some people, but I'm like, this is like what, it's like we've been preaching from day one.
Sounds like somebody sitting in my lobby for the last 10 years here at
Yeah.
the same thing. We offer nutrition here as well. And all of those reasons, you fill the foundation with what the body actually needs, both nutritionally, how we make biomechanically, how the effects of gravity, how we counter those. And all of a sudden, crazy things like health start to appear. It's pretty cool.
Do you think it's gotten more difficult to get results or changes to people over the years as people just in general, like overall health has gone down? I mean, I noticed my practice is like most people who come in are generally very deconditioned.
Yes.
A lot of people are overweight. A lot of people have poor diets compared to what would be an ideal diet. And I mean, a lot of times when you have so many things to address when it really comes to healing, that people like the idea of just coming in and getting quick fix, it just doesn't really happen very often.
Yeah, I'm positive those docs who talk about how effective they were 60 years ago, they were dealing with a better landscape when that person walked in the door. You're right. The average person's deconditioned. I run through a few orthopedic tests that actually ask them to do a few things. And I just watch in awe sometimes at how poorly conditioned a person is. And then they want a miracle fix right then and there. And the body's just not built that way. The body's not, they're chronically dehydrated. They've been eating processed food-like substances as opposed to real food for decades in many cases.
Cool. Now, how many years have you been in practice?
Almost 20.
20. So I'm curious, over those 20 years, has anything changed about your viewpoint or how you do or how you practice or your philosophy? I mean, if you could look at yourself back when you first started as a chiropractor, what do you think is different about you as a chiropractor now?
I took a lot of pride in this mindset. And this actually, my very first mentor gave me this quote, and it's been a very important part of my mind ever since. He said, you can practice for 30 years and you can have the same year 30 times, or you can have 30 years of practice. Always be kind of learning, evolving. And he would follow that up with change is inevitable, growth is optional. Mm-hmm. And that kind of mindset has been there from the beginning. So every time I can learn something new, and this isn't gadget new, this is how can I help this person new? Oh, let me learn this new adjusting technique. Let me learn this new way to treat TMJ, or whatever answer in that regard, so that I look back at that. And yeah, when I started my career almost 20 years ago, what I do then, there's elements I would never do that I've done that I did back then that I've learned since. It's like, that's just not very effective, or that's a higher risk maneuver than you ever actually need to do, whatever that landscape ends up becoming. And then I've evolved from there. I would love one of those time-elapse cameras to see what I've done. It'd be talk about the guy who saw me in doing different treatments in an afternoon. That would be my career.
Yeah. I think I was thinking about this the other day. Like when I first got into practice, I was just bringing on everyone, trying to treat everything. And now I treat, one thing basically. And I love it. I mean, but I think over time you also, plus you're established and your practice is going more, but you kind of know like what you want to do and what you don't want to do, the kind of people that are a good fit for you, the people that are not a good fit for you. And you're more about it, for me at least, attracting the people that fit into what I'm doing and helping the right people, not trying to help everyone. I mean, I have a daughter and a son, and like my son is 4 weeks old and my daughter's 17 months, but like they're born, like we instantly took them to a pediatric chiropractor because I knew some things. I actually did part of the peds certification.
Okay.
After watching 9 live deliveries though, one day I realized this is not what I want to do.
Not what I want to do.
So we went to someone like, this is one of my friends, like, you can't treat me. I can, but I go, I don't treat infants very often. Right. So I took them somewhere else. That's all they did. So if someone's out there watching this, like who's like an ideal patient for your practice?
We probably excel at that weekend warrior person. We do a lot of, my associate was a semi-pro soccer player, high-level soccer player, and we've worked with a bunch of athletes over the years, and practice we're actually trying to even incorporate more of. But the person who is active, we want the person who takes the ski trips every weekend in the winter is mountain biking, and we're keeping them doing the things that they love to do because we're getting the person who comes in the door already somewhat proactive. Have we fixed and helped a ton of people who have the desk job? Absolutely. But the most fun, because I played a bunch of sports, I love having those conversations with those patients. So they're just fun conversations. But that would probably be, if I could have 200 patients in the door, that would be the fun population to work.
Good. Well, the good news is a lot of people like that in Colorado.
I know. It's a high chunk of people who do those things.
Yeah. And so someone out there's watching this, how do they get a hold of you guys? How can they work? Where can they find you guys? Where can they learn more about your practice?
Website, of course, highlandsfamilychiropractic.com, where you can even schedule yourself right from there, straight from the website, or, give us the old fashioned way. Our phone number is a textable number as well.
Oh.
So we always communicate through text that way. In fact, that's probably the most common way patients communicate with us. But that 303-779-7933, textable, call us, we'll get you scheduled.
Excellent. Well, Dr. Andrew, thanks for being on our show.
Hey, I appreciate it. Thanks, Chris.
You bet.